If you're over 60, I want you to imagine this. You go to bed feeling fine, maybe even strong that day. Then you wake up, and you can't move one arm. Your words come out jumbled. Your balance is gone. No warning, no pain. Just a life forever changed. I've seen this happen far too many times in my years as a brain doctor. And here's what might surprise you. It's not always caused by smoking. It's not always poor diet. It's not always a lack of exercise. Sometimes, the trigger is sitting quietly in your own kitchen cabinet, inside a bottle you take every day, because you believe it's keeping you healthy. Vitamins. Now, I'm not here to tell you vitamins are bad. In the right amounts, they can be incredibly helpful. But here's the part most people never hear. The safety of a vitamin depends on three things: the dose, the timing, and whether it interacts with your body or your medications in ways you didn't expect. Too much of certain vitamins can stiffen your blood vessels, thin your blood too much, or slowly break down your nerves. Some build up over time, stored in fat, not flushed away. Others quietly amplify the effects of your prescription drugs, pushing your system into dangerous territory without you knowing. Over the years, I've seen the same 5 vitamins appear again and again in stroke cases, brain bleeds, or nerve damage in older adults. Vitamin D, vitamin E, vitamin B6, vitamin A, and niacin B3. Each plays a real role in health, but in the wrong dose or situation, they can shift from helpful to harmful. That's why today, I'm going to walk you through exactly how each of these vitamins can put your brain at risk. And more importantly, how to protect yourself without giving up the nutrients your body truly needs. Because the real danger isn't the vitamin itself. It's taking it blindly without knowing the whole story. I once had a patient in his 70s, let's call him Walter, who took his health seriously. He exercised, ate reasonably well, and never missed his daily supplements. Among them was a high-dose vitamin D capsule, the kind you can buy over the counter, 10,000 IU in a single pill. He believed it was protecting his bones and keeping his immune system strong. One morning, Walter's wife found him confused, unable to form clear words. His right arm hung limp. He'd had a stroke sometime in the night. When we ran his labs, one result jumped out: extremely high calcium levels in his blood. Here's the connection most people miss. Vitamin D's main job is to help your body absorb calcium. That's essential in the right amount. But when you take far more than your body needs, especially without monitoring your blood levels, you're essentially forcing extra calcium into your bloodstream. Your body doesn't just let that calcium float around. It deposits it into tissues, including the walls of your arteries. Over time, those arteries become stiff and narrow. If this happens during the night, when blood pressure naturally fluctuates, and you may already be slightly dehydrated, you've created a perfect environment for a clot to form and block blood flow to the brain. And because calcium buildup happens silently, there are no early warning signs. You go to bed feeling fine and wake up with your life forever changed. The problem is compounded in older adults because our arteries naturally lose flexibility with age. Add in a spike of calcium at night courtesy of that bedtime vitamin D, and the risk goes up sharply. So, how much is safe? For most older adults who are not deficient, research suggests that even 2,000 IU daily may be more than enough. Many people actually need less. The safest approach is to have your vitamin D level checked through a blood test before starting any supplement, and then recheck it periodically. And here's one more tip. Take vitamin D in the morning, not at night. This aligns better with your body's natural rhythms and reduces the chance of calcium spikes during vulnerable nighttime hours. Vitamin D is vital, but like all powerful tools, it has to be used wisely. In the right dose, at the right time, it can strengthen your health. In the wrong dose, it can quietly undermine it. Evelyn, An 81-year-old retired librarian had always been meticulous about her health. She managed a heart valve condition with prescribed blood thinners, kept her blood pressure steady, and followed her doctor's advice to the letter. One day, after reading an article about natural ways to boost circulation, she added a high-dose vitamin E capsule, 800 IU, to her daily routine. Just 3 weeks later, she was rushed to the emergency room with a sudden, severe headache, nausea, and confusion. A brain scan revealed bleeding inside her brain, a hemorrhagic stroke. She hadn't fallen. Her blood pressure wasn't dangerously high. The culprit was the combination of her prescription blood thinner and the extra, unmonitored blood thinning effect of vitamin E. Here's what most people don't realize. At high doses, vitamin E acts like a natural anticoagulant. It slows down your body's ability to form clots. In small amounts from food, nuts, seeds, leafy greens, that's fine, even beneficial. But when you add large supplemental doses on top of prescription medications like warfarin, aspirin, or clopidogrel, the effect can quietly tip into dangerous territory. The brain is particularly vulnerable because its blood vessels are delicate. Even a small bleed can damage areas controlling speech, movement, or memory. And unlike a clot-based stroke, where quick treatment can sometimes restore function, a brain bleed often leaves permanent deficits. So, how much is safe? For older adults, the recommended daily intake is around 15 milligrams, about 22 IU, which you can easily get from a balanced diet. Most store-bought supplements contain 200, 400, even 1,000 IU per capsule, far exceeding what's necessary for most people. The safest rule is this: if you're already on any medication that affects blood clotting, avoid high-dose vitamin E supplements unless your doctor specifically prescribes them and monitors your blood work. And if you want more vitamin E, aim to get it from whole foods, almonds, sunflower seeds, spinach, where it comes in a balanced, natural form that works with your body, not against it. Vitamin E can indeed help the heart in certain contexts, but in the wrong setting, it can become the quiet trigger for a brain bleed you never saw coming. Harold was 76, a retired truck driver who'd spent decades on the road. When he came to see me, his first words were, "Doc, my feet feel like they're asleep all the time. And now my hands too." He'd started to stumble when walking, needing to grab walls for balance. At first glance, you might think it's just age, arthritis, or even the early signs of neuropathy from diabetes. But Harold's blood sugar was fine. His blood pressure was steady. The real issue lay in a nerve support supplement he'd been taking every day for over a year. Each pill contained 100 milligrams of vitamin B6, and he was taking 2 of them daily. That's 200 milligrams a day, 20 times more than most older adults need. Here's the part most people never hear. Vitamin B6 is essential in tiny amounts. It helps your body make neurotransmitters, the chemicals your nerves use to send signals. But when you flood your system with too much, it can actually strip away the protective coating around your nerves, called myelin. Think of myelin as the insulation around an electrical wire. Without it, the electrical signals start to leak, slow down, or short-circuit altogether. In your body, that means tingling, numbness, muscle weakness, tremors, and eventually problems with coordination and memory. And because vitamin B6 is water-soluble, people assume, oh, my body will just flush out the extra. In reality, that's not always the case, especially in older adults, whose kidneys and metabolism may process it more slowly. Over months or years, high doses can accumulate in nerve tissue, doing damage so gradually you don't realize it until it's hard to reverse. The recommended daily amount for most older adults? Just 2 to 10 milligrams, including what you get from food. That's easily covered by a balanced diet: poultry, fish, bananas, fortified cereals. There's rarely a need for high-dose B6 unless you have a specific medical condition, and even then, it should be prescribed and monitored. Harold was fortunate. We caught it early enough to stop further damage, but some of his symptoms will likely never fully reverse. He told me, "I just wanted to protect my brain. I didn't know I was poisoning it." And that's exactly why I share his story, because even something marketed for nerve health can quietly rob you of the very function it claims to protect. If you take any supplement labeled for brain, nerve, or energy support, check the label. Look at the B6 content. Knowing your numbers could mean the difference between staying steady on your feet or facing a lifetime of imbalance. Dorothy was 79 and had been a piano teacher for most of her life. Her hands were still graceful on the keys, but recently, her head had been pounding. She complained of blurred vision, occasional dizziness, and once, her speech seemed slightly slurred. Fearing a stroke, her family brought her to the hospital. The scans told a different story: no clot, no bleeding. Instead, there was increased pressure inside her skull, a condition called pseudotumor cerebri, sometimes nicknamed a false brain tumor. The cause wasn't a hidden disease, it was the high-dose vitamin A supplement she'd been taking for years for her eyes and skin. Here's what makes vitamin A tricky. It's fat-soluble. Unlike water-soluble vitamins that you can excrete through urine, fat-soluble vitamins A, D, E, and K are stored in your liver, your fat tissue, and even in your brain. Your body holds on to them. That means if you take more than you need, day after day, the levels slowly rise. Over time, excessive vitamin A can cause swelling in the tissues around your brain and eyes, which increases intracranial pressure. Imagine your brain sitting in a space that's just a little too tight. The pressure pushes on nerves, distorts vision, causes headaches, and can even affect balance and thinking. Older adults are especially vulnerable. As we age, our liver processes fat-soluble vitamins more slowly. That means what might seem like a safe daily dose for someone younger could become risky for someone in their 70s or 80s. The safe upper limit for most older adults is about 2,500 to 3,000 IU per day, and that's only if you actually need supplementation. The problem is, many eye, skin, or anti-aging formulas contain 5,000 to 10,000 IU or more, and if you're also taking a multivitamin, you might be doubling or tripling that amount without realizing it. If you want to protect your vision, you don't have to rely on high-dose vitamin A. Beta-carotene from foods like carrots, sweet potatoes, and leafy greens can be converted by your body into vitamin A, but only in the amount you need. It's your body's own built-in safety system. Dorothy's vision has improved since stopping the supplement, but the experience left her shaken. She told me, "I thought I was helping my eyes. I never thought I'd be hurting my brain." It's a reminder that with fat-soluble vitamins, the danger isn't just in a single pill. It's in the slow, silent buildup over time. Frank was 82, a retired postman who'd walked miles every day for decades. When he came to my clinic, he described something odd. Waves of heat in his face, a pounding sensation in his chest, and dizzy spells that seemed to appear out of nowhere. His wife thought it was anxiety. His son blamed his blood pressure medicine. The truth was sitting in his kitchen cabinet, a heart health supplement containing 1,000 milligrams of niacin, vitamin B3 per serving. Frank was taking it twice a day, thinking he was protecting his heart and lowering his cholesterol. Here's what niacin does at high doses. It causes your blood vessels to suddenly expand. That's why people often feel flushed or warm after taking it. But what's less known is that this is quickly followed by the opposite: your vessels constrict or tighten in a rebound effect. This rapid expansion and contraction is like bending a fragile metal pipe back and forth. Each time it happens, the vessel walls experience stress. In the brain, that can temporarily reduce blood flow, leading to a transient ischemic attack. Thanks in advance, sometimes called a mini-stroke. Symptoms can include slurred speech, weakness on one side of the body, or brief vision changes. Even if those symptoms fade within minutes, a thanks in advance is a red warning light that a major stroke could be next. For older adults, this yo-yo effect on blood pressure can be especially dangerous. Many already have some degree of arterial stiffness, making the vessels less able to adapt to sudden changes. Add niacin into the mix, and you may be pushing an already strained system past its limit. The recommended intake of niacin from food is modest, about 14 to 16 milligrams per day for most adults. That's easily met through whole foods like poultry, fish, nuts, and whole grains. Anything above 50 milligrams a day should only be taken under medical supervision, especially if you have high blood pressure, heart rhythm issues, or a history of stroke. Frank stopped taking the supplement, and his dizzy spells disappeared. He was lucky no permanent damage. But his story is a reminder, even a vitamin with proven benefits in certain cases can turn into a hidden risk when the dose and context aren't right. Niacin isn't inherently bad. But like so many things in medicine, the key is not more, but just enough. And no more than that. After seeing so many patients harmed by well-intentioned supplement use, I've learned this. Your brain doesn't need a cabinet full of pills to thrive. It needs real food. Supplements can help in very specific situations, but for most older adults, the safest and most effective brain nutrition plan starts on the plate, not in a bottle. That's because food delivers nutrients in balanced amounts, along with fibers, antioxidants, and natural compounds that work together in ways no single capsule can match. Take leafy greens like spinach and kale. They provide folate, vitamin K, and antioxidants that reduce inflammation and support blood flow to the brain. Fatty fish, such as salmon or sardines, are rich in omega-3 fatty acids, which help keep the membranes of your brain cells flexible and efficient. Berries offer polyphenols that protect neurons from oxidative stress, while nuts and seeds supply healthy fats and natural vitamin E in safe food-based doses. Whole grains, oats, quinoa, brown rice provide steady energy by keeping blood sugar stable, something your brain depends on every minute of the day. Even something as simple as staying hydrated with water, herbal tea, or broth supports optimal brain function by ensuring that nutrients can be delivered where they're needed. When you build your meals around these foods, you're giving your brain exactly what it needs, in the right amounts, at the right pace. There's no sudden spike in a nutrient level. No dangerous accumulation, no hidden interaction with your medications. If you do use supplements, make them a small part of the picture, guided by blood tests and medical advice, not magazine ads or online promises. Your brain is an organ that thrives on balance, and nothing brings balance like a diet of fresh, whole, nutrient-rich foods eaten consistently over time. If there's one thing I hope you take away from this conversation, it's that knowledge is every bit as powerful as any pill you could swallow. The vitamins we've talked about, D, E, B6, A, and niacin, are not villains by nature. In the right dose, at the right time, for the right reason, they can be part of a healthy plan. But without awareness, they can become the silent forces working against you. As we get older, our bodies change in ways we don't always feel day to day. Our metabolism slows. Our blood vessels become more fragile, and our tolerance for excess narrows. What felt harmless at 40 can have very different consequences at 70 or 80. That's why your greatest protection is not just in what you take, but in how you decide to take it. Read labels, ask your doctor before adding something new, get your blood work done before starting high-dose supplements. And perhaps most importantly, listen to your body's whispers before they become shouts. A twinge of dizziness, a change in balance, an unusual headache. These are messages worth hearing. You are not powerless in this. Every choice you make, from the time you take a vitamin to the way you build your plate, is a step toward either protecting your brain or putting it at risk. I've seen patients reverse dangerous habits simply by becoming aware of them. That's the beauty of awareness. It gives you control, and control, at any age, is the foundation of independence. So tonight, before you reach for that bottle in your cabinet, pause, ask yourself, do I truly need this? And if you're unsure, get the answer from someone who can look at your health as a whole. If this message resonated with you, share it with someone you love. You never know whose life might be changed by a conversation like this. And if you found value here, Leave a comment with one small change you'll make. Starting today, your story might inspire someone else to take their first step. You're not alone in this journey, and it's never too late to take back control of your health one informed decision at a time.